On a cotton farming commune near the eastern coast of the People's Republic of China, a barefoot doctor named Xiao Shu makes house calls to ailing patients in her brigade. Before the establishment of the People's Republic, medical services were almost non-existent here, as in most agricultural areas throughout China. Malnutrition and epidemics were widespread. In 1949, China had only 20,000 doctors. Today, there are nearly 200,000, and many are working in the countryside. But the main force of the rural healthcare system is the barefoot doctor, a paramedic like Xiao Shu, who provides health and medical services on the farms. The vast improvement in rural health conditions rely greatly on modern medicine, but an innovative usage of traditional resources was China's principal strategy against the age-old problems of disease. In the past, trained medical personnel stayed in cities like Peking to work in fee-for-service clinics or in hospitals built by foreign missionaries. Urban dwellers still benefit from modern medical facilities, such as the Peking No. 2 Friendship Hospital. Today, nearly all city residents receive professional medical care provided through low-cost health insurance. It is hoped that someday, health services will be entirely government-funded. Free medical care for factory workers and 50% coverage for their dependents was made available in the early 1950s. Factories contracted with nearby hospitals for the services of professional doctors and nurses. As a result, medical care for workers improved, but it relied primarily on an urban, hospital-based medical delivery system. In 1965, in what has become his famous June 26 directive, Chairman Mao insisted that in health and medical work, the stress should be on the rural areas. China needed doctors not only in the cities, but on the farms where 80% of her population lived. But how could China, relatively poor in resources and medical manpower, provide adequate health services for over 600 million people in the vast countryside? As a result of Mao's directive, 20% of China's medical personnel were transferred from urban to rural areas to provide health services, but their main task was to train locally based paramedics, the barefoot doctors. The name barefoot doctor is a literal translation of the Chinese term 赤脚医生. It was originally a nickname for rural medical workers who, like other farmers, sometimes work without shoes. Its main purpose is to symbolize the kinship between the peasants and the paramedics. Lao Huang is a barefoot doctor in northern China who spends half of his time working in the rice fields. In his barefoot doctor kit, he carries first aid equipment and some medicines. The number of medicines he can prescribe is determined by his training and experience. Some medicines are manufactured in neighboring communes. Others come from factories in Shanghai. Advanced barefoot doctors may spend less time in the fields, but some farm work is required for everyone. Lao Huang earns as much as other farmers with the same labor power, about 40 Chinese dollars per month. When Lao Huang is working in the clinic, other members of his production team assume his responsibilities in the fields.
那这样第三个身体的声音。
你这么简单是得了，有嗅到这么重，是吧？
反而讲话也不好，反而讲话也不好，还得让。
All communes are composed of smaller units called brigades. Each brigade maintains a small clinic which serves approximately 1,500 people. The number of barefoot doctors per clinic varies from commune to commune. At the July 1 commune near Shanghai, 3 barefoot doctors are interviewed about how they were selected and trained. Candidates are nominated at open meetings, then approved by health officials. Qualifications are based on record of public service and aptitude for health work. Family background and political attitudes are also considered. The primary motivation for becoming a barefoot doctor must be to serve the people.
我当了3年。
当了3年。这个你。
我也当7年，
所以你们2个都是7年，你是3年了。
时间分布的特点是不一样。
In the late 1960s, the initial group of barefoot doctors was trained on the communes for 1 to 4 months during the agricultural slack season. In some areas, basic training is now a more formal 6-month program financed by the government. These students at the Shenyang School of Public Health will eventually receive a total of 2 years of classroom and clinical instruction. Over half of the barefoot doctors in this class are women. Preventive skills are emphasized, but the students also learn to treat diseases common to their local agricultural areas. They are also trained to recognize symptoms for more difficult cases, which will be referred to full-time physicians at commune or county hospitals. As part of their basic medical program, barefoot doctors study gynecology and obstetrics. They will play an active role in China's family planning campaign. Professional doctors from local hospitals or those traveling with mobile health teams periodically conduct classes for barefoot doctors to upgrade their medical training. Physicians from the People's Liberation Army also supervise continuing education on the communes, most of which is in clinical work and independent study. Although 2 years of cumulative instruction is the goal, some of the most dedicated and talented barefoot doctors will eventually enter medical school and become physicians.
The
barefoot doctors in turn train health workers to assist in prevention activities. Educational programs emphasize personal hygiene and environmental sanitation. Water samples are collected periodically from local wells and tested for contamination. Cholera and other waterborne diseases have been controlled by the paramedics through mass immunization campaigns. But the lasting success of their efforts can also be attributed to an increased concern for sanitation. Parasitic diseases, such as schistosomiasis and hookworm disease, have been aggravated by the custom of using human feces as fertilizer. Much effort is spent teaching farmers how to store and compost human waste.
坚持每到7到10天，
Barefoot doctors inspect backyard night soil deposits, which must be kept away from living quarters and covered. Farmers collect the night soil, which will be fermented or treated chemically before use in the fields. By taking these precautions, parasitic diseases have been greatly reduced, though not yet totally eliminated. Periodically, entire communities are mobilized to kill disease-causing insects. The national anti-pest campaigns of the 1950s were directed against flies, rats, mosquitoes, bedbugs, and roaches. During the summer, farmers clear rainwater from ditches and spray insecticide to keep mosquitoes away from their homes. Malaria and other diseases have been greatly reduced, but mosquitoes breed in wet rice fields and are still a nuisance. The theory of attacking the source of disease has also enabled the Chinese to control certain infectious diseases, such as syphilis and gonorrhea, which are virtually non-existent in China today. Symptoms were publicized during small group meetings and over the mass media. Affected persons were urged to go for treatment. Health education for the public is a major part of the Barefoot Doctors Prevention Program and China's principal strategy against disease. As the Barefoot Doctors gradually increase their medical skills, they are able to provide more curative services. Gao Zhang has been a barefoot doctor for 3 years. Like most barefoot doctors, Gao Zhang works in his native village, where many of his patients are relatives and friends. These personal ties help to promote close doctor-patient relationships, which are largely responsible for the effectiveness of the paramedics. The barefoot doctor's patients pay the equivalent of $1 per year, or approximately 1% of their annual income, to a cooperative insurance fund. The brigade contributes a matching amount, which pays Gao Zhang's salary. Most, but not all communes have a cooperative health plan. In addition to Western medical techniques, traditional Chinese treatments are administered by barefoot doctors. The most popular is acupuncture, which has been used for centuries as a method for treating various ailments, such as headaches. Over 1,000 insertion points are charted and linked by meridians, which once possessed mystical significance. The meridians are lines connecting stimulation points, which are said to affect the same internal organ. According to one of many theories, internal reactions occur because of a cutaneovisceral reflex. The advantages of using acupuncture as an analgesic for surgery were not discovered until the early 1960s, during experiments conducted by Chinese doctors. Both Western-style medicines and Chinese herbal medicines are prescribed at the clinic. Patients can specify a preference. Herbs are grown commercially or collected by the peasants on their days off and sold for additional income. Some herbs are grown by the barefoot doctors in small garden plots behind the clinic. Urban housewives and retired people receive some health care benefits. With encouragement from the government, they have also formed their own health care groups, electing their own paramedics called Red Health Doctors. Most of the Red Health Doctors are middle-aged housewives who spend part of their time educating their neighbors in health care matters and part of their time with other activities, such as babysitting or tending to household chores. Household tasks may include caring for homegrown ginseng plants and other medicinal herbs. The collection of home remedies may also include a colony of insects called earth turtles. Although their medicinal value is not immediately apparent, the tubia, as the Chinese call them, seem to make good pets. Lao Liu is a Red Health Doctor at the Xichang'an Hutung in Peking. Like the barefoot doctors, she emphasizes preventive measures but has had less medical training. At this health station, services such as this acupuncture treatment for rheumatism cost as little as 5 cents. Many people, especially older patients, still prefer traditional Chinese treatments. Despite its long history, traditional medicine was ignored by China's Western-trained physicians until Chairman Mao insisted that indigenous medicine should be recognized also. Lao Liu probably knew how to give acupuncture treatments before becoming a Red Health Doctor, but now she is supervised by a trained physician and knows some Western techniques as well. Lao Liu and her partners also know how to make 10 varieties of herbal pills, one of which they say is very effective against the common cold. Dried herbs are ground in a stone grinder, sifted and ground again until all the ingredients are powdered.